Okay, we discussed the ketone bodies. So the ketone bodies includes here the three ketone bodies. We have your beta-hydroxy butyric acid, constitute here 78% of your ketone bodies, followed here by the 20% acetoacetate, and we have here the acetone, which is the 2%. So ketone bodies are products of your abnormal fat metabolism. So generally, we utilize as our source of the energy in our body. Number one, our body try to prefer here the utilization of your carbohydrates. But if your body could not utilize the carbohydrate, it resort to your protein. And then if you use up all your protein, then your body will utilize your fats in order for you to have the energy. Okay, normally we try to catabolize our fats and breaking it down to your carbon dioxide in water. But too much utilization of your fats that result here to your ketone bodies. Okay, bakit tayo nagkaroon ng excessive fat utilization? Because number one, basically because you could not utilize your carbohydrate as your energy source. So, hanap ng para ng katawan natin to find here the source of its energy. So, that's why it resort here to your fats. Okay, so number one, okay, so the problem here with the excessive utilization of your fats is basically because of the problem in the utilization of your carbohydrates. And that's you could not utilize your carbohydrates or you don't have the carbohydrates. The first one, you could not utilize the carbohydrates in the case of diabetes because remember the patient with diabetes do not have here the insulin. And therefore, wala siyang transport vehicle here that would transport the glucose from your plasma going inside to be taken up by the cell in our body. And therefore, hindi nagagamit ang ating carbohydrates. Second one, okay, meron kang carbohydrates, but eventually it result here to the excessive loss because of vomiting, diarrhea, sinusuka mo, sinatae, so nawawala ka din ng carbohydrates. And third one, wala ka talagang carbohydrates because of the decreased intake. Because number one, okay, we have here your starvation, wala talaga siyang nakakain. Ito naman, madami siya nakakain, pero sinusuka niya lang, remove lang niya sa katawan niya. Ito naman, third one, okay, wala talaga siya makain. Starvation, malabsorption. Ang problem sa malabsorption is may kinakain ka, but you could not reabsorb because there's a problem in your microvilli in small intestine, which is the site of your reabsorption. And therefore, still could not utilize the carbohydrates. And all this one resort here to the utilization of our fats in our body. And that's result to your ketone bodies production. Okay, we have this one. Okay, why are we testing for the ketone bodies? So pag sinabi natin ketone bodies, again, this is the product of your too much carbohydrate or too much fat utilization in the absence of your carbohydrates or you could not utilize the carbohydrates. Okay, so in the case of the type 1 diabetes mellitus, type 1 diabetes mellitus, wala talaga silang insulin. So pag wala talaga silang insulin, wala siyang choice kundi gamitin ang kanyang fats because of course it could not really utilize the sugar or the glucose as its energy source. Okay, and therefore, okay, this one, ketone bodies determination is very important here to determine here the need for adjustment for the insulin. So, pag konti ang insulin or hindi enough ang insulin that would allow the body of the patient here to utilize the carbohydrates, then magkakaroon ng ketone bodies. I mean to say, pag nag-positive ka sa ketone bodies, kulang ang insulin sa katawan ni patient. So, for the management, bibigyan siya or i-adjust ng physician ang dosage ng insulin natin. Okay, that's why you are testing for the ketone bodies to make necessary adjustment as to the dosage of your insulin that would enable your body then to utilize the glucose. So pag okay na ang insulin production or insulin level or dosage, magne-negative ka na sa ketone bodies. Mean to say, nagagamit na ng katawan ni patient ang kanyang glucose or carbohydrates Kaya wala ka ng ketone bodies. Or hindi na siya gumagamit ng lipids because enough na ang kanyang carbohydrate as a source of his energy. Okay, the presence of your ketone bodies in your blood, you call that was ketonemia. And the presence of your ketone bodies in the urine, you call that was your ketonuria. However, here, increased concentration of your ketone bodies result to the following. Delikado nito. Electrolyte imbalance, dehydration. We have also here acidosis and of course here the diabetic coma in the case of your type 1 DM. Okay, now we go to the reagent strip test principle here for your ketone bodies. So the reagent strip here for the ketone bodies utilize the test principle sodium nitroprusside test. So this sodium nitroprusside impregnated in your test pad will only react in your acetoacetate or even your acetone, but not with your beta-hydroxybutyric acid. Okay, so that one, acetoacetate, sodium nitroprusside, we have your glycine. Kung acetone, ang makikita niya or what is present na ketone bodies in the body of the patient is the acetone, then this test strip, the sodium nitroprusside reagent test pad will also react with your acetone, provided that you are adding the glycine. Then, okay, the positive result here, we have the purple acid dye. Again, the test pad will not react with your beta-hydroxybutyric acid. You need to break down or convert first your beta-hydroxybutyric acid to your acetoacetate or even to your acetone. Confirmatory test for your ketone bodies, we have here the tablet test in the form of your acid test tablet. The following are the reagents in your acid test tablets. So you have sodium nitroprusside, you have your glycine, disodium phosphate, and we have also here the lactose. Lactose, try to enhance here the color visualization. So we're able you to have here better color result. Okay, so acid test tablet is not only for the urine. You could also utilize your other body fluids like your serum or even other body fluids as your sample. Magpa-positive, okay pa rin siya. Applicable itong ating acid test tablet. Procedure for that one, so we have here your tablet, na acid test tablet. You add 1 drop of your urine, then observe here for the color change. Purple would be also, okay, although you have manufactured chart for that, you just need to compare for that. But then again, ang pinaka-end result natin na consider here positive would be the purple. Okay, then we have here the interferences. Okay, false positive result would be reagent with your reagent test pads. Could be obtained here for the presence of your dyes like your phenolsulfonylene, bromsulfonylene, and we have also here your sulfhydryl containing compounds will give all the positive result. Okay, the false negative would be associated here with the unpreserved na specimen or not fresh na specimen. Remember yet your ketone bodies are highly volatile. So pag hindi siya agad na process, it results here to the breakdown of your ketone bodies. And at the same time, it will also be broken down here because of your bacterial decomposition. And therefore, it results here to your false negative result. Okay, the next test pad here, we have the test for the blood. So this test pad will try to detect here the presence of your blood. So we're talking about the RBC. And this is good about, what's good about this test pad here, it could detect both your RBC, which is intact RBC, and even lyse na RBC. Okay, so what's the advantage of this one with our microscopic identification of the RBC? When you're doing your microscopic identification, you tend to report the presence of the RBC seen under the microscope with your smear or your slide. Apparently, what you see in or under the microscope when you are doing your microscopic identification would be an intact na RBC. Kasi yun ang nakikita mo. Pero may mga RBC tayo na nag-lyse na sila. So, mintos pag na-lyse, hindi mo na siya makikita under the microscope kasi pumutok na siya. But then again, you were able to miss that one if you're doing your microscopic identification. But when you're testing here for the chemical test for the blood with your reagent strip, it could detect even if your RBC is an intact RBC or even your lysed na RBC. Another thing about this one, okay, so this one would allow also to detect here the RBC more than 5 RBC. So more than 5 RBC is already significant. Okay, so sometimes here, if you just rely, if you're not able to test your urine here with this chemical tests, diba, our urine sample will not be grossly bloody red na color ng urine if mga 5 or 6 lang ang RBC ang makikita natin. Okay, so diba, usually we suspect for the presence of the RBC if mapula na ang ating urine. Pero again, pag mga 5 or mga 6 lang na RBC, it will not give you a grossly bloody na urine specimen. Okay, but then again, that's already significant because you have more than 5. 5 is already significant. 5 or more RBC is already significant that would diagnose you someone to have here a bleeding manifestation. Okay, so we have here the 3 medical conditions related to the presence of the blood in the urine. So, first one, hematuria would be the identify here having your cloudy red na urine. And this is identified here by the presence of your intact RBC. And this is related to the following conditions. We have your renal calculi or the presence of the kidney stone. So because ginagasgas ng ating bladder of the stone, so you will have your bleeding related to that. We have also your glomerulonephritis, pyelonephritis. We have also your strenuous exercise, and even your anticoagulant misuse. Hemoglobinuria and your myoglobinuria would have your both na clear red na color ng urine. Hemoglobinuria would be characterized by the presence of your lysed na RBC related to your hemolytic reactions. Like your hemolytic transfusion reaction. Hemolytic transfusion reaction ay nag-transfuse tayo ng blood na hindi compatible ang blood ni donor sa recipient, and that results to your hemolytic reactions. Another one, hemolytic anemia, and even your malarial infection could lyse the RBC. And that result here to your hemoglobinuria with your clear red na urine sample. Myoglobinuria, myoglobin is your muscle protein. So this condition arises related here to your muscle wasting diseases or muscle-related disorders. Muscle wasting diseases, rhabdomyolysis or crash injuries, or even administration of your cholesterol-lowering drugs, mga statin na mga drugs, could also result here to your myoglobinuria. Okay, so, how would we differentiate between your hemoglobinuria and myoglobinuria? You can, you can extract the blood and try to centrifuge your blood and then try to observe for the color of the plasma. Pag ang color ng plasma natin ay red throughout, so that's your hemoglobinuria. Pag ang plasma natin ay after centrifugation ay naging clear, that your myoglobinuria. Another test that would differentiate between your myoglobinuria and your hemoglobinuria would be your ammonium phosphate. This is 2.8 grams ammonium sulfate. Okay, so, this is sulfate. Okay, so this test would eventually try to, differentiate between your myoglobinuria and your hemoglobinuria. All you need to do is just your urine sample, then you add here your 2.8 grams of your ammonium sulfate. Then after that one, try to centrifuge your urine sample. Okay, your ammonium sulfate, try to precipitate your hemoglobin, but not your myoglobin. What do you mean by that? So after centrifugation, kung na-precipitate niya, so dito makikita, sa precipitate na natin, makikita ang ating hemoglobin. But your myoglobin, hindi niya na-precipitate ang ating myoglobin. So after that one, after centrifugation, your precipitate try to settle here at the bottom. And therefore, we are expecting that your hemoglobin is already here also at the bottom here because again, it try to precipitate your hemoglobin. And then what you need to do here is just take out your supernatant. The supernatant is the liquid portion and the upper portion. And try to test with your test strip for your blood. If you try to take here the supernatant, okay, pag tinest mo siya, pag negative ang result, that's your hemoglobinuria. Bakit nang negative sa hemoglobinuria? Because again, your hemoglobin is no longer present in your supernatant. Kasi andito siya sa precipitate natin. Okay? Whereas your myoglobin is not precipitated by our ammonium sulfate. And therefore, if you try to test the supernatant, andun pa rin siya sa supernatant. So, pag tinest mo siya ng ating reagent test pad, so still magpa-positive ang ating myoglobinuria because again, it's not precipitated by our ammonium sulfate. So, therefore, your supernatant still contain your myoglobin. So that will also help us then to differentiate between the myoglobinuria and your hemoglobinuria. Okay, now we go to your reagent test pad principle here for the test for your blood. So this one, try to utilize the principle of your, okay, the test principle of that is the pseudoperoxidase activity of your hemoglobin. So the pseudoperoxidase activity, this is the peroxidase activity ni hemoglobin natin. So ito kanyang reaction. So we have peroxidase here, hemoglobin peroxidase. I mean to say this is the blood present in the sample of your or in the urine of the patient. Ang mga ito, hydrogen peroxide, chromogen, ay mga reagent tests or mga reagents natin na naka-incorporate sa ating test pad. So, ang dinedetect sa sample natin will be this one, ang enzyme na peroxidase coming from your hemoglobin because you have your hemoglobin in your blood or you have your hemoglobin na present sa urine ni patient natin because that one contains here the blood. Okay, the chromogen uses your tetramethylbenzidine that would change the color here from yellow. Yellow is negative, magiging green to blue na color if this one is positive. Okay, then it will be catalyzed here by your enzyme peroxidase from your hemoglobin of your sample in the urine that would change the color of your chromogen. Oxidized chromogen is the change in color na. So ito magiging positive result natin. Okay, for our result here, if you have your hematuria, it would have your speckled blue-green na color of your test pad. Bakit speckled siya? Pag sabing speckled here, so may mga ganyan, hindi siya homogeneous. Okay, because what you have here in your hematuria would be the presence of your intact na RBC, and that is responsible here for the speckled appearance of your test pad. For your myoglobinuria and then your hemoglobinuria, then you have homogeneous blue-green na color of your test pad. So wala siya mga bilog-bilog or buo-buo. Because what you have here would be a lyse na RBC. Okay, again, this test pad will give a positive result if the RBC present is 5 or more than 5. But what is present here, for example, is less than 5 na RBC, it will give a negative result. Now we go to your interferences. Okay, false positive result would be identified here if you have your menstrual contamination, menstruation. Menstruation, hindi naman siya, di ba, related to bleeding manifestation. So, it's just a normal na condition. Hindi naman siya sakit, di ba? Okay, then another one, the presence of your oxidizing agents because of course, okay, because ang ating principle dito, try to oxidize. Okay, so if your oxidizing agents is present, so pareho nito, trying to oxidize your chromogen, so magpa-positive din siya. And then of course here, we have also your bacterial peroxidase. So some bacteria contain this enzyme. So pag nagkaroon ng bacterial contamination ng ating urine, so it might give us a positive results. Okay, false negative. So always, ascorbic acid is a reducing agent. Basta pag nakita nyo ascorbic acid, false negative siya palagi. Then formalin, captopril, high specific gravity tend to make your RBC crenated. Pag na-crenate ang ating RBC, hindi siya magla-lyse. Pag hindi siya magla-lyse, okay, eventually, it will not release the peroxidase na enzyme and would have the tendency na mag-false negative ang kanyang reaction. Another one, false negative, would be the presence of your nitrite. Okay, so that's all for your blood. Okay, now we go to your bilirubin. So, we consider bilirubin here as the breakdown product of your RBC destruction. So, galing siya sa ating RBC. So, bilirubin is a waste product. And this one is being processed in our liver. So, pag mag-increase ang bilirubin natin, we're suspecting for the presence of your liver problem. So, we have here the normal breakdown or catabolism of your hemoglobin that would eventually result here to the production of your bilirubin. Okay, so we have your hemoglobin. So, pag nag-rupture ang ating RBC, it try to release your hemoglobin. Your hemoglobin could combine with the haptoglobin. Okay, so that's your hemoglobin, haptoglobin, okay, complex. Or another option, once your hemoglobin has been taken up or once the RBC has been taken up by our RES, your reticuloendothelial system, that includes your spleen or even your macrophages, it try to break down your hemoglobin to your heme and your globin. When the globin will be recycled, it will be returned to your amino acid pool for storage. Because this one is your protein, you can recycle that one. So therefore, it's being returned to your amino acid pool for storage for recycling. Your heme, on the other hand, will be acted upon by the enzyme heme oxygenase. It will be converted to your biliverdin. Okay, then your biliverdin is further converted to your unconjugated bilirubin or your B1 by the action of your enzyme biliverdin reductase. Unconjugated bilirubin, what the property of your unconjugated bilirubin, your B1, is not water soluble. So pag not water soluble, eventually could not be transported or could not move here from one part of your body to other part, not unless that one is being carried here by our transport protein. You need to carry this one because ang ating pinaka-objective natin dito ay eliminate natin ang ating breakdown products dito because this is our considered to be waste products na ito. So for the unconjugated bilirubin, kung hindi mo siya ita-transport, so hindi siya ma-eliminate. And this one is not water soluble and therefore should be transported along with your transport protein. So, kailangan niya mag-combine sa transport protein natin in the form of your albumin in order for that to be transported to the organ of elimination or body para ma-eliminate or ma-excrete sa katawan natin. So, dalawa lang yan. Pwede siyang pumunta sa kidney para lumabas sa ihi natin or another one, pupunta siya sa liver for another pathway for catabolism of that. Okay, so once your unconjugated bilirubin or the B1 combined with albumin, it become protein bound. Okay, so ito na, pag pumunta siya sa kidney, ano mangyayari? Okay, pagdating niya sa kidney, your glomerulus, ano ulit ang glomerulus natin? Glomerulus will not filter substances which are protein bound. Okay, so it's impossible here na lalabas siya sa ihi natin. Okay, through your kidney in the form of your B1. Okay, so hindi siya pupunta, so hindi siya makakalabas sa ihi natin, hindi siya makakalabas sa katawan natin by passing through your urine. So, anong na lang mangyayari? So, other option here is dadalhin siya sa liver natin for conjugation process para ma-eliminate siya sa katawan natin. Your conjugation process, kailangan mo ng glucuronic acid at kailangan mo nitong enzyme UDP, uridyl diphosphate glucuronyl transferase para mag-transfer ng glucuronic acid to your B1. Pag nag-transfer ka ng glucuronic acid to your B1, magiging ano siya, conjugated bilirubin or bilirubin diglucuronide. Because to try to transport, you try to add glucuronic acid. Bilirubin diglucuronide. Or you call that once your conjugated bilirubin. Once you have already your conjugated bilirubin, this will be excreted, okay, as part of your bile. Okay, then your bile will be temporarily stored in your gallbladder. Okay, not unless you are needing the bile. So, once you are needing the bile, kailan ka mangangailangan ng bile? Your bile is needed for the emulsification of your fats. So, mean to say, pag kumain tayo ng fats, para ma-digest natin ng fats, kailangan natin ng bile because the first step in your lipid digestion process is the emulsification of fats, and that's being done by your bile. So here na, pag nangailangan ka ng bile, in a case because you have eaten here lipid-rich diet or meal, so your bile from the gallbladder, okay, pupunta siya sa small intestine natin. Okay, so again, remember your bile contain already your B2 or your conjugated na bilirubin. So, pag ang bile natin pumunta sa small intestine, your B2 conjugated bilirubin will be converted to your urobilinogen by the action of your intestinal bacteria. Okay? Again, magiging ano siya, urobilinogen ang ating B2 or conjugated bilirubin pag makapunta siya sa small intestine natin. Pero pag hindi siya makapunta sa small intestine, it will not be converted to your urobilinogen. Okay, now, ano mangyayari sa urobilinogen natin? So, ang urobilinogen, okay, majority of that, pupunta siya sa ating, okay, fecal sample here. Pupunta siya sa large intestine. Again, by the action of your intestinal bacteria, it will be converted to your pigment na stercobilin. Stercobilin is the pigment responsible here for the color of your stool. Okay, that's one option. Another option, yung urobilinogen, pupunta na siya sa circulation natin. And pupunta siya sa kidney. Okay, pagdating sa kidney, it will be converted to your urobilin. And remember that your urobilin is the one giving you a characteristic color ng ating urine. Pag pumunta na siya sa kidney, this time, pwede na siyang ma-eliminate because this is no longer protein-bound. Kasi nawala na sa albumin, di ba? Nung hinatid na albumin, si B1 natin sa liver, hanggang doon lang sa albumin natin. After I try to transport, mag-dissociate na siya. Okay, then, ganun. So, pagdating dito, wala na sa albumin. At pag pumunta na ito sa kidney, ang ating urobilinogen, pwede na siyang ma-excrete. Because, again, it's no longer protein-bound. Or another option, urobilinogen could eventually recirculate, papasok ulit sa liver. Pag pumasok ulit sa liver, so ito ulit mangyayari sa kanya. Okay, now we go to the clinical significance. Okay, so we have here the three conditions, pre-hepatic, hepatic, and post-hepatic. So just like your pre-renal, renal, and post-renal. Pag pre-hepatic, okay, the problem here is not on the liver. Okay, so kung ito ang liver natin, ang problem mo dito is dito sa part na to, sa taas. The problem with that is the blood itself. Madami kang blood or madami kang RBC na nag-rupture. Okay, so mean to say, hindi dito ang problem sa liver, dito na part sa taas. That's your pre-hepatic. So, mga hemolytic reactions. Hepatic condition here, so mean to say the problem is in the liver. Dito mismo ang problem sa liver. Like what? Hepatitis, liver carcinoma, or liver cancer, mga ganon. That's your hepatic. Okay, post-hepatic, ang problem is with your bile duct obstruction. Example, we have your bile duct obstructions. Okay, ulit, pag post-hepatic, okay, this is your liver, this is gallbladder, small intestine. Pag may bara dito, that become your post-hepatic. Pag may bara dito, that's your post-hepatic or may obstruction. Okay, so pag pre-hepatic, okay, ang mataas na bilirubin na type of bilirubin will be your B1. Again, your B1 is your unconjugated bilirubin. Pag hepatic ang problem natin, ang nag-increase na type ng bilirubin is your B1 saka B2. Pag post-hepatic, ang mataas natin is your B2 or your conjugated na bilirubin. Okay, now we have here ang result ng urine natin. Okay, you need to understand this one. So, bilirubin, urine bilirubin, urine urobilinogen. Okay, pre-hepatic, ano ang result ng ating urine bilirubin is negative. Bakit negative dito sa pre-hepatic? Because remember your B1, unconjugated bilirubin, is protein-bound. So, ulit, pag protein-bound, pag dinala sa kidney natin, okay, so makakalabas pa siya o hindi? Di ba? Hindi. So therefore, expect na magiging negative ang result mo dito. So again, urine bilirubin dito. Okay, your B1 pag pumunta sa kidney, hindi siya makakalabas, di ba? Because it's protein bound. And therefore, negative ang ating urine na bilirubin. But your urine urobilinogen is positive for that. Okay, hepatic urine bilirubin, positive or negative. Urine urobilinogen, positive or negative. Post-hepatic. Again, post-hepatic ang problem natin dito, di ba? May obstruction. Okay, pag may obstruction dito ulit, ang ating bile hindi makapunta sa small intestine. Pag hindi makapunta sa small intestine, hindi ka magkakaroon ng urobilinogen. Okay, because again, your B2, conjugated bilirubin, magiging urobilinogen lang siya pag pumunta sa small intestine upon the action of your intestinal bacteria. Since may obstruction ka, okay, you're post-hepatic, so therefore, your bilirubin will not be converted to your urobilinogen. Kaya, anong urobilinogen natin? Negative. But here, positive tayo sa ating bilirubin for that. Okay, so this is actually the clinical significance for both your bilirubin and our next na test pad na urobilinogen.